Hello and welcome to another beautiful edition of Iron Port, the program that has been dedicated to bring Ghana's port and maritime industry closer to you. The program is powered by the Ghana Ports and Harbours Authority and is sponsored by the Ghana Revenue Authority, Goyle Company Limited, Serene Insurance, Ghana Link, and the Meridian Port Services Limited. Our media partner is the Business and Financial Times. Viewers, this week we are centering our discussion on the International Maritime Hospital. We are going to find out how IMaH has been contributing to the fight against COVID-19. We'll also touch on a few of other services being provided at the hospital. Take a listen.
Tell us the role you played when COVID first broke at IMaH and some of the things that you did to support the country's quest to contain the pandemic.
As an emergency physician, when COVID started breaking out, not even in Ghana, I anticipated that whatever we do, we'll get COVID coming through the emergency. So I prompted our CEO, the management of IMaH, and then with the help of GPHA management, we put in some strategies to set up a COVID ward and a COVID monitoring team, that's to start early testing. And luckily for us, GPHA they were very willing to get us the equipment we needed, and then the medication, some of them were not even in the country. They helped us procure those medications. So at the beginning, we've had good success rate with COVID because we started testing earlier. We had a policy. Once you are in the emergency, whether for COVID-related illnesses or not, we'll test you for COVID.
Yeah.
So we ended up getting the people who had COVID without symptoms, and treated them earlier before it got worse. That was where we got our reputation for having good success rates, because we screened everybody through the OPD and in the emergency for COVID. And I think it helped us catch COVID, I would say, in infancy before it went out of proportion.
So what would you say were some of the things that you did that culminated in the selection of IMaH as one of the referral centers in our country?
Ghana, we anticipated that if we had a lot of severe cases, we would be overwhelmed because we have limited ICU spaces. So one of the things that made IMaH stand out was we had improved and expanded on our critical care service for COVID patients. So we were one of the out of 4 hospitals in Ghana that was taking critical COVID cases. And I think it set IMaH apart.
What would you say your success rate was in terms of managing the pandemic and managing patients? I
would say our success rate was very high. We treated over 1,000 COVID patients, but only 500 were actually sick enough to be admitted. And out of the 500, our mortality has been less than 20 compared to other hospitals. Because we were very aggressive in our management. We didn't hold bars, so we went in guns blazing. So we had very good success rate. As of 2 months ago, we had technically closed our COVID ward because the cases were more like mild, so we're seeing them through the OPD, the outpatient department. But 2-3 weeks ago, we had an influx of COVID cases again, so we had to reopen the ward. So currently, as I'm speaking, since 2 weeks, we've managed almost 30 inpatients. So, and then right now, we are realizing that there are more kids being affected than children. Previous waves, we had more, you'll see 1 or 2 kids, pediatrics coming. But of late, every week, we have a pediatric case as young as 2 months.
Wow.
Yes, with COVID, very bad COVID infection. So we still keep on preaching to people the prevention methods. If you are an adult and you have a kid, you may wear the mask. You forget that the child was not wearing a mask, and they can get it. And usually, when kids are sick, it breaks everybody's heart. Like Absolutely. It's so disrupting. So the COVID numbers have gone up again. We are seeing more cases of the COVID at the emergency, and then we are doing more COVID admissions.
Now you can even see it. People are not adhering to the protocols, even though there's been a resurgence, there's been a surge in some places, and the Ghana Health Services on air, announcing that let's get back to the way we were when it first broke in 2020. But people seem not to budge.
I agree with you, but the thing is, how people have lived with it for 2 years. People are tired. But in our facility, we still encourage hand washing, wearing your nose masks. All our clients, we encourage them to vaccinate or top up their vaccinations. If you already had one, those who've had 1, 2, we ask them to go for boosters. And all our clients with chronic illnesses, we follow up and make sure their vaccinations are up to date. Because if you're hypertensive, we don't need COVID coming into the situation to make things worse.
Yeah.
But with the national policy, it's only banks and other few institutions
no mask, no entry.
Yes,
I wanted to ask you whether you think that it's a good thing we go back to it.
I think that would be the barest minimum. Just nose masks would be okay.
Well, let me come to Dr. Champong. Doc, you have just assumed reins of a CEO of IMaH.
Yes.
What are some of the systems you came and met, and what are some of the subtractions and additions you are making?
Well,
these systems, if you are making any, anyway.
Sure. One of the good things that IMaH did, or my previous CEOs and management did, with the help again with the GPHA, was producing our own oxygen. I mean, I think Dr. Cabo, mentioned how well IMaH handled the COVID. But in the COVID treatment, as we all saw, oxygen was a critical part. So IMaH, we had our own system that we are producing oxygen. So we always have sufficient oxygen to the point whereby we also, selling it to other hospitals or giving to other hospitals.
Right.
On that sector, what we have done is that as COVID was about to, surge, we decided to have excess oxygen available. Right. Therefore we don't run out of oxygen. Because it's very, very crucial. That's one thing. The other thing is that when we took over, IMaH has been here only for 5 years.
Yeah.
So within the 5-year period, the previous CEOs and management did very well. Put IMaH in its pedestal now, as we are talking about. So my duty is to build on what they have already done, and so far I think we've done very well. One of the things that when I took over that was concerning, all the complaints that we are having, people were complaining, not the service, but at times the way we interact with patients, the way we interact with people that we provide service to. So we decided to look into that critically, that even though I'm sick, I need a care, not only medical care. I also need psychological care. I also need, loving, tender care.
Yeah.
So we decided to build on that, and that has helped us significantly.
I'm so inquisitive because when you walk about in town, a lot of people say a lot of good things about IMaH. World-class, international standards and all that. What is it that sets IMaH apart?
Well, that's very simple. The planners of the hospital actually thought about certain things, and then they want to make sure that IMaH doesn't become any ordinary hospital or any ordinary clinic in Ghana. So they thought of having one-stop shop, meaning that once you come there, everything you need is there. And also they put up, some professionals, that well-trained and pull them from different facilities, and put them together. If you look at the name International Maritime Hospital, the international here means international standard. So they want to promote healthcare, because see, if you go to most hospitals or most clinic, the treatment that you get is really not optimal. Okay, so, but IMaH, because they want international name, they wanted to create that. Right. And as my colleague, Dr. Cabo said, we serve expatriates. Okay, we serve the seafarers.
Right.
Now, seafarers are coming from overseas. They have some standards, some expectations. So can we meet that?
Right.
So the builders thought of it that way, which is the GPHA thought of it. Can we meet that standard? So that was how IMaH was built. If you look at the buildings, you look at the rooms, you look at even the environment, it is equivalent to any hospital in the world. I've been to so many hospitals in US. If I blindfold you and put you in IMaH, and I tell you in any New York hospital, you believe it. That is the standard that they want.
And most of the people that seem to be the bourgeoisie, like the elite. And so it gives people the impression that this hospital, we cannot afford it. And so we better not dream or even think of going there. Is that really the situation? Is IMaH, really for only the elite in our society?
Well, that is one of the myths, that IMaH is only for the elite. No. Our price is comparable to most of the private hospitals in Tema or Accra. It may be a little bit above, simply because our cost unit is higher based on what we have, the environment that we have, but it's very compatible to I don't mention any other hospital name, but it's very, very compatible. The reason why people thought it was for at least one, our location, and two, because it was owned by the GPHA, which another myth is that it's only GPHA workers that comes to IMaH,
Absolutely.
which is not true.
We know that IMaH has a world-class diagnostic center. That does a wonderful job, and everybody's talking about it. Tell us about it. Why is that? Everybody's talking about everybody wants to have his or her labs done at IMaH.
The originators wanted to have a first-class, hospital, so they put a first-class diagnostic machines such as MRI, CAT scan, mammograms, sonogram, echocardiogram. I've worked, like I said, many areas in hospitals. The MRI that we have in IMaH, I have not seen it. In even the US, it's a Tesla 3. Yeah. Tesla 3 gives you a very clear pictures. That is the highest so far that is out there.
Right. In our previous conversations with previous executives of IMaH, they give us the impression that IMaH, it was the first of its kind in the West African sub-region, premised on the maritime component. We just want to find out from you, can you expatiate and tell us why this is and whether you actually agree?
Yes, I do. Because where we're situated, we are just next to the sea. Ghana has three main entries. We have the, airports, which serves the airline industry. We have the land borders, who serve the inland flows, and then the sea, also serve the seafarers and, those coming in from that transit. Now, IMaH is situated in a situation whereby if somebody is sick in the deep sea, in West Africa, where should they go? I mean, we have the Nigerians, we have the Togolese, we have the Ivorians, all the way to, Liberia, Senegal. Where should they go? Yeah. Okay, so we think that, I might believe that if anybody is sick in the deep sea in the west coast of Africa, they must come to Ghana and they must come to IMaH. And yes, we are receiving so many people in the deep sea when they get sick, even when they get COVID in the deep sea, they call, or if, God forbid, something happened, in the deep sea, they always come to Ghana. One, Ghana is safe, as we all know, among West African countries, and Ghana is also one of the best, Ghana in general has one of the best medical systems in West Africa. Therefore, the people in the deep sea would like to come to Ghana. So IMaH is just right there, okay? That though, when you get to port is very good at that. They have a clinic at the port to take care of people immediately. And once you leave the port, we have the port clinic, a GPHA clinic, which is also there to serve the need of the people. And then if you get sick, you come back to, IMaH. So it's a three-step process that GPHA has put in place. The port clinic, which is situated right in the port, which has an ambulance, and then they do have the GPHA clinic, then also the IMaH hospital to take care of them. So it's something that they thought about it, and I think they actually put their money where their mouth is, and they put out such a beautiful hospital to serve their needs. Not only the seafarers, also the people in the Tema, Sakumono, Ashaman, Ho Accra are also welcome to IMaH to serve, to experience the culture of IMaH health service.
Now that we have heard from our people from IMaH, let us also hear from you on your comments, questions on the subjects that was just discussed. This one is from Maxwell in Michelle Camp. He says, I have been to IMaH before and I can attest to the quality of service they deliver. This one is from Alex in Takrade. He says, good evening, Iron Port. Can you find out from Dr. Ichampon when exactly he believes the helipad services at IMaH can begin in earnest? Alex, the CEO of IMaH said, the aviation authorities are helping IMaH do the technical preparations to be able to fly helicopters in and out of IMaH. So the time for the commencement of the helipad services is not yet determined. This one says, ask Dr. Barbara if IMaH is really prepared to take on emergencies that come from the port, because most of the port areas are operational and accidents are very likely. Thanks for your question. Doc says appropriate procedures are already in place to handle accident cases in connection with the port at IMaH. So IMaH is saying the hospital is open to all, including seafarers and stakeholders within the international maritime community. So make sure to patronize their services. Iron Port will return shortly.
Every now and again, Goil makes good things happen. This time, Goil has introduced Super XP Ron 95, a higher grade fuel loaded with additives and yet sold at the same price as normal fuel. Goil Super XP Ron 95 enhances engine performance like never before. It maintains the engine by keeping it clean from carbon deposits. Goil Super XP Ron 95 is designed to burn slowly and thus improves fuel economy, making you save money after several kilometers. Goil Super XP Ron 95 gives you a smooth driving experience, that is, less vibrations. Fill up with Goil Super XP Ron 95. Now there's no need to pay more for any higher grade fuel. Goil has that sorted. Goil, good energy.
Electricity, pay your taxes. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Talga, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is. You still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
Impressive factory. If only I had listened to you, I wouldn't have been in this mess. That devastating fire virtually wiped out the whole factory and my warehouse.
Remember my misfortunes last year? Serene Insurance Asset All Risk Fire policy that I took were there to pay for my damaged stocks in the warehouse, and my machines that were affected by the floods have been replaced. My accident vehicle is back on the road thanks to Serene Insurance motor policy. Currently, my goods are on the high seas, covered with their marine cargo insurance policy. I was just telling Ajima about Serene Insurance.
Oh, Ajima,
tell him more.
As a road contractor,
I make sure I do my contractors all risk insurance for the projects and then workers' compensation for all the workers on site. With Serene Insurance, they will make sure they will cover your unknown tomorrow today.
Serene Insurance, a new face of insurance. Call us now.
MPS Terminal 3 is Africa's new state-of-the-art container terminal at Tema Port. For manufacturers, agro-processors and traders, the new port means business can be done faster. This infrastructure boost will improve Ghana's port handling capacity, connect more trading routes, and oil the engine of growth for the economy, creating greater opportunities across all sectors as Africa's markets merge and become the largest trading bloc globally. MPS, we connect, you thrive.
Thanks for staying. Now, the track and trailer identification policy at the port of Tema is undergoing piloting. The following story will tell us more. The implementation of the track and trailer identification and inspection policy at the port of Tema is currently in its pilot stage ahead of its implementation in August. The track and trailer identification and inspection policy is being rolled out to ensure that haulage trucks using the port are identifiable and in good condition to carry cargo. As such, all trucks that use the port for hauling of cargo are expected to register with the port for access and verification. As part of the pilot program, selected security officials who represent the monitoring team to inspect vehicles have undergone a 3-week training on the port loading radio frequency identification, also known as RFID, that would be used to verify trucks registered with the port. The security staff underwent both theoretical and practical training on the use of the RFID systems for access control. Bafo J. Mensah, Director of Operations at Auto Consults Ventures Limited, the authority's technical partner, said The ultimate goal of the program is to encourage an appropriate maintenance culture.
The port load safety program, or the port load worthiness program, the port is initiating through ACVL or have contracted ACVL to do on their behalf, is to register all the trucks that operate in the port or that wish to operate in the port. We identify them by tagging them with RFID and keeping all their data in one system for verification at the gates. And we also conduct port load safety inspections on them. The inspections to ensure that the components of these haulage trucks that they use in carrying cargo, that is their twist locks, their fifth wheel, air hose, connection for brakes, lights, are all present and they are functioning properly. That the component that secures and carries cargo are present and are functioning properly. You know, the truck carry loads, work, do evacuation, that's a lot of things, and there are wear and tears on the truck. So what this project hope to achieve is that it inculcates the culture of appropriate maintenance so that these truck owners and drivers will keep their maintenance schedules on a high.
He said both GPHA and traders stand to benefit substantially from the policy.
When these trucks that are carrying the cargoes are in good conditions, one, cargoes will also be in good conditions. Lives and properties in the port will also be safe because accident rates in the port based on these components that are not functioning will be drastically reduced. Traders in the port, they can now be assured that since the trucks that are carrying their cargo that they have imported or are exporting, these trucks are in good condition, so they now can be assured that their cargoes will reach their destination safely. And these accidents, as I said, that have been happening will be drastically reduced.
Now let us take our lenses to the global scene and pick a few international shipping and maritime related stories next. The UK government is moving forward with its new legislation that would require segments of the shipping industry to pay seafarers at levels at least equivalent to the UK national minimum wage. Seen as a political response to P&O Ferries' mass firing of crews in March 2022, replacing them with contract workers, the shipping industry, however, remains critical of the draft legislation, saying it has gaps and could negatively impact other parts of commercial shipping and port operations. The draft of the Seafarers' Wages Bill received its first reading in the House of Lords on July 6 after being announced in May during the Queen's speech that sets the priorities for the new legislative session. The draft focuses on vessels and services that call at UK ports at least every 72 hours on average, or more than 120 times a year. Vessels meeting these criteria would be subject to the requirements. This is an attempt to narrow the legislation so as not to cover the broader commercial shipping industry, but it is unclear if it would cover vessels such as commercial fishing boats that operate from the UK. KVH, a global leader in mobile connectivity and inertial navigation systems, has rolled out the world's first satellite, cellular, and Wi-Fi hybrid network service with one single terminal on board. The service includes KVH satellite coverage on the Intelsat network with speeds of up to 20 megabits per second, plus integrated 5G LTE cellular service in 150 countries. The terminal has an integrated Wi-Fi bridge for extra cost savings and speed when alongside the pier. Some vessel operators and service providers have worked out their own hybrid VSAT 5G solutions before, but this is the first service and hardware package to integrate all three with a single invoice. According to KVH, they are introducing a new standard for integration, convenience, speed, and affordability for commercial seafarers and leisure boaters worldwide. With the Iranian nuclear talks seemingly going nowhere, along with efforts to improve the Iranian oil trade, the U.S. Department of the Treasury's Office of Foreign Assets announced a new wave of sanctions on companies and individuals, as well as 2 vessels, all tied to the trade in Iranian oil. This comes as the U.S. also remains in a dispute with the Iranians via the Greek courts over an oil shipment on tankers that was sanctioned in February 2022. According to the announcement, the sanctions targeted an international network of individuals and entities spanning from Iran to Vietnam and Singapore that has used a web of Gulf-based front companies to facilitate the delivery and sale of hundreds of millions of dollars worth of Iranian petroleum and petrochemical products to East Asia. U.S. authorities said the network had conducted significant transactions for the sale and transport of petroleum products from Iran dating back to at least November 2018. Now, this is the time we take a look at the schedule of vessels that have berthed in the ports of Tema and Takoradi, those at anchorages of those ports, as well as those expected in the coming weeks. Also, the Bank of Ghana exchange rates, which you may need to know to clear your cargo with. This is where we draw the curtains on today's edition of Iron Port. We hope you've been informed and educated. Remember, you can watch all Iron Port content on our YouTube channel, Iron Port. Subscribe, like, and give us feedback. Thank you for watching.